say hello to everybody and thank you for joining. And if we can all give ourselves a minute, and then everybody else will have a chance to join us this morning. Thank you. It's a lovely day. I'm down in Sussex, and it's beautiful here. The sun is shining, and very much looking forward to your talk, Ellis.
Good. Nice to be invited, and it's so nice to touch base with Wellbeing again. After I always follow it, and I have a number of patients ever ask me, can I give you something? I said, don't give it to me. Send some money to Wellbeing. So I like to support it.
Thank you, Ellis. I think that we are actually going to start because we're doing well here. So I'd just like to say a warm welcome and thank you to everybody for joining us today, and welcome to our guest speaker, Mr. Ellis Downs. I'm delighted to say that you're a consultant gynecologist and obstetrician. You trained in Leicester, where you first became involved with Wellbeing of Women, and stepped up to help on the fundraising and raising awareness. So thank you, Ellis. And then came down to London and have spent many years at a number of different hospitals as a consultant. Now, before I hand over to you, what I wanted to do was just tell people a little bit about Wellbeing of Women. So we are the women's health charity, saving and changing lives of women, girls and babies. We're very much led by women's voices. We improve health and well-being through research, education and advocacy. And in fact, today's event has been driven by women's voices. We asked women what they would like to hear about and learn about. And this whole subject of the health of the vagina was very much up there. So I'm pleased that we are following what we say. We very much believe that women's lives should not be limited by their reproductive and gynecological health. And our work covers the life course of women, periods, the reproductive years until post-menopause, including issues around osteoporosis, frailty, and so on. Now, we women make up 51% of the population, and we influence the health behaviours of our families and the wider community. So it's very important that we have the best information when it comes to making choices about our health. So much of our health, women's health, remains shrouded in secrecy. I mean, it's really unbelievable. I found out a fact yesterday that there are at least 5,000 different euphemisms for periods alone. The menopause is another issue that doesn't get talked about a lot, and things like infertility and miscarriage, which affects 1 in 4 couples. So it's really important that we talk about these issues and that we're not shy and embarrassed, because if we understand our bodies better and our health, then we'll be able to talk to our doctors and get the help that we really need. So what I ask of all of you here today is please help us break these taboos, raise awareness and raise funds for Wellbeing of Women so that we can continue to fund vital research and find the next breakthrough that we need to in women's health. And that we make sure women have the right information so that they can advocate for themselves. Please sign up to our newsletter on our website, attend more of our events and take part in our fundraising activities, because your donation will help us and it will help you, it will help women and the girls in your life. Now, a little bit of housekeeping. We are recording this webinar so that people can go back to it at a later stage. And also, if you want to ask a question, please do so in the chat box. And Ellis will try and answer some of these questions at the end. So now I am going to hand over, and I know that Ellis will put up his slides. Thank you.
Lovely. Thank you very much indeed. Let me just get the technology up and running. Right. Here we go. Lovely. Well, thank you very much indeed for that very kind introduction. And ladies, I think it's mainly ladies. I don't know who's actually participating, but it's a great pleasure to be invited to participate in this lunchtime learning opportunity. I'm Ellis Downs. I'm an obstetrician and gynecologist. I was for many years a consultant in the NHS in North London, and I'm now in full-time private practice at the Portland Hospital with a clinic in Harley Street. You'll see my contact details down the bottom, and if you've got any questions or any follow-up, please don't hesitate to get in touch. The vaginal biome, I think, is such an important subject, and what I want to do really, this is a bite-sized talk, so it is no apologies, it's a quick brush over. I want to say a little bit about what it is, why is it important in female health, how can we review it, and most importantly, what can we do to maintain microbiome health? And I found it so interesting in the last 6 months to a year as we've been struggling with COVID, that many women have been having problems with their microbiome, and I'm going to discuss that and hopefully give you some practical tips to really maintain female health. So the vaginal microbiome, the vagina is not sterile. I'm sure most people know that, but the vagina normally is a mixture of bacteria and fungi, and really the vaginal microbiome is the collective term for all the microbes that are found in the vagina. And we very much talk about good bacteria and bad bacteria, good fungi and bad fungi. And essentially, if for any reason that normal balance of good and pathogenic bacteria and fungi is compromised, that leads to an imbalance, which we know as vaginal dysbiosis, bacterial vaginosis syndrome, BV. There are a variety of different classifications, but probably one of the most important bacteria that is in a woman's vagina, quite normally and quite healthily, is lactobacilli. And the reason that lactobacilli is important is it actually leads to, it makes secretions. It's a rod-shaped bacteria. It looks like a little rod. I'll show you a picture. And that makes a very weak acid. And the normal acidity in the vagina is actually a mild acid. So the normal pH in the vagina is between 3.5 and 4.5. And it's that very weak acidic environment that acts as a protection against pathogenic infection in the vagina. Now, this very delicate mix of good and bad bacteria and fungi can easily be affected. One of the commonest ways, as I'm sure most people know, is antibiotics. So if you get a chest infection and you take some antibiotics, many women may find that sadly they develop a vaginal yeast infection, commonly due to candida. And some people can take antibiotics and have no problems. Many women sadly find that they just take antibiotics and they get a terrible vaginal yeast infection. So much so that many of them find that it's probably worth almost taking a prophylactic antifungal vaginal treatment when they take antibiotics because they know it's going to happen. Vaginal douching, most gynecologists are not fans of vaginal douching because it washes away, it damages the healthy bacteria and it damages the acidic environment. So douching definitely affects the microbiome. Reduced immune system is really probably one of the commonest things, and it's affected by stress. So when we are stressed, our immune system goes down, and that can lead to recurrent vaginal infections. And obviously, if you are ill, then that affects your immune system. So you can often get secondary vaginal infections, vaginal discharge, itching, odor, if you have a systemic illness due to a reduced immune system. Obviously, sexually transmitted diseases, pathogenic bacteria, viruses can affect the microbiome. Estrogen levels are very important in maintaining the biome because estrogen has an effect on glycogen in the vaginal mucosa, and it's glycogen that actually the lactobacilli use to make the vagina acidic. So therefore, even if you have normal lactobacilli, if you don't have a minimum level of estrogen, then you're less likely to have the appropriate vaginal pH and more likely to get recurrent vaginal infections. And this can occur with stress, but it can particularly occur in the peri and postmenopausal age of reproductive life, which is why women of a certain age are more likely to get recurrent infections, minor bacterial infections, or yeast infections. If you have a biome which is not normal, faulty, call it what you like, well, what can happen? Well, obviously that can cause disruption to the nerves in the vagina and on the perineum, which can cause vaginal itching. You may have a discharge, and the discharge may come from either the bacteria or the overgrowth of pathogenic bacteria causing vaginal discharge. Sometimes if the vaginal skin is thin and the skin is rubbing together, you can get a weeping type discharge from a very thin vaginal skin. Sometimes the discharge may be associated with an odor, and sometimes that can cause vaginal pain either in itself, or it may cause pain with intercourse because of underlying problems with the biome. Those are all unpleasant symptoms, but of themselves, they may not necessarily be dangerous, but they're not nice to have, and they're easily fixable. Obviously, more seriously, if the normal balance of bacteria and yeast in the vagina isn't normal, this increases the risk of late miscarriage, and it also increases the risk of preterm labor. And infection, vaginal infection, lower genital tract infection, is actually the commonest identifiable cause of preterm labor. And there is an awful lot of research at the moment trying to identify exactly what are the right strategies to screen for women at risk of preterm labor, and what should we be doing in terms of treatment options to reduce the chance of going into preterm labor. And there have been huge advances in this area. Some of them have been funded by Wellbeing for Women, but there's a lot more work we need to do to understand this. And this is just a small graphic which just shows you, this looks at a number of different studies, and there's been a meta-analysis which just shows, for example, that in women who've had a bad outcome, if you give them clindamycin cream, which is an antibiotic, you can reduce the risk of going into preterm labor by the odds ratio of 0.6. So in other words, if you can manipulate the vaginal biome, you may reduce the risk of going into preterm labor. So very exciting that we now have strategies that we can actually improve outcome measures moving forward. And now lactobacillus, which I've mentioned, is a very important good bacteria. There are, if you actually look and you take swabs from the vaginas of women who've had a normal delivery at term and those who've had ruptured membranes, you can see that the women who have a greater amount of what we call bad pathogenic bacteria are sadly much more likely to have a bad outcome. And I'm sure all of you will have heard of streptococcus, and there's a particular type of streptococcus, Lancefield group B strep, and group B strep may be associated with pre-labor rupture membranes, increased risk of preterm delivery, and sadly an increased risk of early neonatal death. The big challenge we have at the moment is that many women, up to 15 to 20% of women, will have group B strep in their vaginas, and they have no problems at all, and may have no problems at all. So identifying an appropriate screening strategy to try to identify which women may benefit from treatment or not treatment is still far from clear. And there's an awful lot of research work going on to this. And there's a big difference really globally around the world, how group B is screened for and treated in the vaginas of pregnant women, with a view to see how that can affect outcome moving forward. Let me say a word about the dreaded COVID. I personally have found, as a gynecologist, it's absolutely fascinating what has been happening. It's been ghastly times, and there isn't any of us who have not found the last year a very stressful and anxious time. We've all been stressed in different ways. Now, you cannot do a blood test to measure stress. But we all know what stress is. We're worried about our parents, our grandparents. We can't go on holiday. We're fed up from working from home. We're worried about losing our jobs. And we know that stress affects the hippocampus in the brain, which indirectly affects the pituitary gland, which can affect estrogen. So I have seen as a gynecologist many of my patients in the last year who have relatively low estrogens. And what has that meant? Well, many women have had irregular periods or no periods because of this low estrogen. I've seen many of my patients have had recurrent vaginal discharge, low-grade infections because of low estrogen. And they may have developed menopausal symptoms earlier, or they may have developed transient menopausal symptoms when they're not really menopausal because of low estrogen. So I'm at the moment looking at collating this and writing a research paper looking at the non-infective aspects of coronavirus on female health. And part of that is low estrogen caused by the stress of the pandemic is causing recurrent vaginal discharge, which I think is a really interesting finding. And interestingly, if you have more pathogenic bacteria because your vagina is not its normal acidity, we are starting to see more abnormal cervical smears, only minor abnormal smears, borderline changes, possibly due to the pathogenic milieu in the vagina. And time will tell whether this translates into problems, but it's a strong reminder about the need for all women to have cervical smears in this COVID time, despite the fact that it is often quite difficult. And I'm sure all of us have got stories to tell of the challenges of trying to access GPs at the moment. It's hard to get a consultation, whether it's telephone, and it's even harder to get a face-to-face examination. But so important women have cervical smears regularly because of these particular issues going on. So if you look at vaginal lactobacilli, we have a scale which is called the Nugent scale after the doctor who looked at it. And you can see on the left here, this is normal lactobacilli taken from a vaginal swab. They look like rods and they have a acidic vagina. And some women who get recurrent infections with an odor, they don't have these rods, and they may have a more alkaline vaginal pH, and they may have some of the vaginal cells that come off, which are called clue cells. And we can actually look at exactly what is bacterial vaginosis, because it allows different bacteria, typically Gardnerella, Klebsiella, in the vagina, which can cause symptoms which I've described. So bacterial vaginosis syndrome undoubtedly is not just one condition, it's a range of different conditions. So in terms of maintaining a healthy biome, I've given you an overview of what it is and how it can let us down sometimes, what the symptoms are, and what may cause that. How can you keep your vaginal biome healthy? Well, obviously, you won't be surprised that I tell you to avoid vaginal douching. Lifestyle is terribly important. Try to have a healthy lifestyle to reduce stress. Sleep, exercise is good. Diet, reduced carbs is probably good to try to reduce carbohydrates, try to reduce hyperglycemia, which may have an effect. We know that vitamin D deficiency is actually very common, and vitamin D has an effect on collagen metabolism, which may make it easier for yeast and bacteria to get a hold on the vaginal mucosa. So many of my patients who have recurrent vaginal discharge, I check a serum vitamin D, and often it's a bit low, and intensive vitamin D supplementation can be very beneficial. Obviously, practicing safe sex is very important to try to reduce the risk of STDs. Live yogurt, which has not been sterilized or pasteurized, has high levels of lactobacilli. And some patients benefit from actually doing douching with live yogurt. Very important. So buy this from a health shop, check it hasn't been pasteurized. And many of my patients who have a low-grade infection or are prone to these, I say get a tampon and put a tampon in a fridge so it's chilled. And if it's chilled, it tends to be stiffer, and just dip the tampon into the live yogurt and put it into your vagina, and do that morning and night for 20 minutes. And that is a very nice way of getting some lactobacilli back into the vagina if you're getting these recurrent discharge. And you can either do that on a prophylactic basis, or if you feel you've got a minor infection coming along. Vaginal probiotics, there are lots of vaginal probiotics around. Some of them, many of them are a waste of time. There are some which are extremely good and have been shown in evidence-based trials to be of major benefit in reducing vaginal infections. I recommend taking appropriate vaginal probiotics for early onset of symptoms. I personally, as a doctor, I think we've got, generally most of us have got pretty good immune systems, and the immune system is very good at dealing with infection. And I don't believe just because you have an infection, you should automatically have a medication for it. Keep healthy and look at things that you can do to deal with it. And if it is getting worse, then obviously it may need antibiotics or antifungals. But certainly with vaginal discharge, there are a lot of self-help regimes, which mean you don't need to take formal medication. Sometimes you can take this for the early onset of vaginal infection. But I also have many patients who take them routinely just after they finish their period for 5 or 6 days to really maintain their vaginal health. If you are low in estrogen, certainly topical estrogens can be very, very beneficial. Many of my patients benefit from those. Postmenopausal patients, and I've actually been prescribing more topical estrogens, either estrogen cream or estrogen tablets in the vagina, particularly with the issues that we've found in the last year of lowish estrogens, which I've touched on, that can be very helpful for maintaining a healthy microbiome. So in terms of take-home messages, well, the vaginal microbiome is a very, very important part of female health, and it's increasingly recognized. As we're getting newer diagnostic molecular techniques, we can hopefully identify healthy from less healthy microbiomes in women and look at strategies to optimize vaginal health. There is a strong need for good quality research to guide us in terms of our interventions moving forward. And the vast majority of symptoms can be treated quite easily and really with a few little interventions can be resolved. And I think it's so important, as in the whole of female health, to try to identify a balanced and individualized approach in dealing with these challenges. Thank you very much.
Ellis, thank you so much for that. Really interesting. Picking up on actually your point about getting sleep and reducing carbs, a couple of people have asked about, is there anything specific in diet and alcohol and coffee? Do these have sort of an effect?
If you look at the evidence, I mean, alcohol and caffeine have not been shown to have, in huge levels, to have be specific markers to increase the risk of recurrent low-grade vaginal infection. But I think anything that, you know, I'm a great believer, everything in moderation. I like a cup of coffee, I like a glass of wine, but, you know, just be steady, keep healthy, and look at whatever one can do to boost the immune system, which definitely helps maintain estrogen levels, which is so important for the vaginal environment.
Okay, we've got a question that actually isn't directly related. It's from Vicky, who said regarding recent slight increasing abnormal cervical smears, she says, might this not be more related to ways smears are now done, as in tested first for HPV?
Not really, no, because obviously the HPV screening, it looks at high-risk HPV, and if you've got high-risk HPV, the lab then go on and do thin prep cervical cytology. Yeah. So what we're seeing is we are seeing more borderline changes over the last few months, and the more borderline changes is probably a reflection of the change in vaginal acidity, just slightly affecting the vaginal biome, and seeing exactly what's going on. So I don't think it's a change in methodology. I think it's a real phenomenon. We're going to keep an eye on it. It shouldn't necessarily be any problems because it's just a local infective etiology type problem. But we'll watch your space, and the message is have a smear, don't be late on a smear, and manage accordingly. I'm just having a look here. 2 people have asked me names of recommended probiotics. I'd love to answer this question. I've been specifically told I'm not allowed to mention any brands, which personally I think is a shame because there are some very good probiotics and there are some very probiotics which are not good and are a waste of time. So having been told I'm not allowed to mention it, if anybody would like to know, please email me and I'd be happy to follow up.
Thank you, Ellis. That's really, really helpful. There is another question here, which is to do with for menopausal women who can't tolerate topical estrogen, and an intolerance of progesterone means that systemic HRT is also difficult to take. And I wondered if you had anything you could add on that.
There are very, very few women who are not suitable to take topical estrogens. The amount of estrogen that is absorbed into the bloodstream through vaginal instillation is very low. It's extremely safe. We know that we don't need to worry about increasing endometrial thickness. Many women will know that the uterus may be affected by estrogen and the lining may thicken, which may develop into hyperplasia if you take oral estrogen or estrogen patches. But you don't need to talk about you can take it very safely. So the first question is, you need to see many GPs, in my experience, or let me phrase that, some GPs are overcautious about prescribing topical vaginal estrogens. They're very safe, and with a careful history, most women can take vaginal estrogens, the vast majority. So I think that you need to basically see a gynecologist who has a good understanding of hormones, and I would say the vast majority of women should be suitable for a trial of estrogens. And when I prescribe vaginal estrogens, I take them as a boost. So intensive estrogenization every day for 1 month, and then drop back to every other day, something like that.
Marlene, we really must end. We've only got 1 minute left. Marlene Jordan Hart has said, what is your view on vaginal beauty cosmetics? Is this needed? And more importantly, good for your vaginal health?
We're running out of time. I'm just going to tell you, don't waste your money on this. The evidence is not strong. Follow my advice and you will have healthy vaginal female health.
Thank you. And again, don't forget to watch Channel 4 tonight or do a catch up. It should be very good. Ellis, can I just say thank you very much for today. It's very kind of you giving up your time. And also, can I just say thank you to everybody who joined us. And I know that some of you wanted Ellis's email. It is up there. We look forward to welcoming you back to our next event. Okay, thank you very much.
Look forward to it.
Goodbye.
Thank you very much.
Bye.
Lovely. Cheers. Bye.
Bye.